Good evening, everyone, and welcome to the Sigma Global Nursing Excellence Psi Upsilon Chapter Induction Ceremony. I'd like to first welcome and introduce your chapter leaders. My name is Carol Liske, and I'm the president of the chapter. Our vice president is Deborah Abey. Our secretary is Tracy Lookenbill. Vanessa Lee is our treasurer. And our faculty counselor is Elsie Chidester. We also have many other men and women who serve in a chapter leadership role, serving on our advisory board. First is Phil Tarantino, chair of the Finance Committee. Tammy Owen is chair of our Governance Committee. Christy Johnson is chair of our Induction Planning Committee. Candace Johnson is chair of our Leadership Succession Committee, and Patty Rowe is chair of our Membership Involvement Committee. Jeanette Benson is chair of Program Committee. Melissa McLaren is chair of Publicity Committee. Vicki Martin, chair of our Scholarship and Research Committee. Heidi Johnson Anderson is chair of our Philanthropy Committee. Leanne Farmer is chair of our Key Award and Strategic Planning Committee. And Janine Barrett is chair of our Technology Committee. Special thanks goes out to Elsie Chidester, our faculty counselor, Christy Johnson, the chair of our Induction Planning Committee, and Janine Barrett for helping organize and coordinate today's wonderful event. Thank you so very much. I also would like to welcome all of our inductees and members attending this evening and your guests. It is truly a pleasure for us to be inducting you into the most prestigious nursing professional organization in the world. First, I'd like to tell you a little bit about our chapter. We were chartered in July of 2017 at a beautiful ceremony in Salt Lake City. Member of the Sigma International Board, Kenneth Dion, presided over our chartering ceremony, at which time we became the 546th chapter of Sigma. The ceremony identified key philosophical and important tenets of the organization that we pledged to uphold when we accepted the chartering for the chapter. And currently, Sigma, Theta, Tau, that represents love, courage, and honor, are our foundational principles as a nursing organization. So what does that mean? Well, that means that as a formal organization, we are technically Sigma Theta Tau International Honor Society of Nursing. Our new branding that occurred within the last couple of years gave us a new title that was a bit more contemporary and also was relevant around the world to Sigma Global Nursing Excellence. However, there are some official documents and official seals that we maintain on our chartering documents that still reflect what we were when we were founded over almost 100 years ago. The crest has a lot of symbols. In the upper quadrant, you'll notice the I, and the I stands for wisdom and discernment. The pillars of stone on the right and left of the crest represent service, professional endeavor, and strength of leadership. And the lamp that many of us are familiar with, Florence Nightingale's lamp, represents knowledge. We also have a key and a laurel. The laurel branch represents the excellence of Sigma nurses. If you look down in the bottom right corner of the slide, you'll notice that in the brand, there's a subtle break on the final 3 leaves. And that's because those 3 leaves represent the sigma, theta, tau, love, courage, and honor key elements of our society. The key is what you will see when we wear it as a membership pin. The Greek letters in black represent our charge. The cup denotes the satisfaction of professional life. The circle with the 6 stars represents our 6 founders, and the lamp is the lamp of knowledge. So today, Sigma, known worldwide, has a mission to advance world health and celebrate nursing excellence in scholarship, leadership, and service. And our vision is to be the global organization of choice for nurses. The past of Sigma, as I mentioned, was founded in 1922 by 6 nursing students at what is now the Indiana University School of Nursing. Adams, Belford, Copeland, Lingaman, Miller, and Wright were quite instrumental in identifying the key elements and tenets of the Honor Society. Since 1922, our organization has grown to expand into more than 90 countries around the world with over 500 chapters, and we have over 130,000 active members worldwide. Being a member of Sigma is not just an honor, which it certainly is for students and nurse leaders such as yourselves joining our society, but it also provides you with a lifelong resources that can benefit you throughout your career. Being a member of Sigma allows you yearly access to career advisors, virtual face-to-face networking opportunities, savings of over $700 on continuing education programs, access to free journals like the Journal of Nursing Scholarship and the Research in Nursing and Leadership, and also all of the various programs for leadership, academies, midwifery, and opportunities to grow in your role as academicians, clinicians, and leaders. Sigma also has a marketplace, which is my favorite place, that has wonderful items, beautiful, beautiful items of jewelry, but more importantly, tremendous books many of which are used in our schools of nursing for textbooks, and also other Sigma items that you would enjoy. And we also sponsor what we call the Circle. I guess you could call it Sigma's Facebook. It's a wonderful opportunity to social network with nurses around the globe. There are different groups that you can join that are specific to your clinical domain or your professional interests, or simply just to post a question about something and you'd love to hear from nurses around the world as to how they may be managing certain things. Our professional peer network is a wonderful wealth of knowledge. But Sigma isn't just for us individually. Sigma speaks on behalf of nurses worldwide, as well as the patients and the clients that we serve. In the last 5 years, Sigma has become quite involved in the United Nations. First, as a member who was able to sit in and listen at meetings. And in the last few years, we gained what's called ECOSOC status, economic and social status. And what that did is that brought us to the table. We have members of Sigma in our Global Initiatives Department that actually sit at committees, present to members of the UN about nursing and about those things that matter most to nurses around the world. One huge initiative that I'd like to share with you that is truly a jewel in the crown of the nursing organization is GAPFON, which stands for the Global Advisory Panel of Nursing. Over the last 4 years, Sigma has sponsored regional advisory panels around the globe, during which they identified challenges and opportunities for nursing to improve nurses, midwifery, and those that we serve. After they conducted all of the regional panels, they identified themes, and interestingly, there were several key themes that seemed to straddle all cultures and all countries. And of course, there were issues that were country and nation specific. But from those themed areas, they identified recommendations, and all of the members of Sigma, in association with other international nursing organizations like WHO, the World Health Organization, and ICN, the International Council of Nurses, are looking at ways to address and to achieve the recommendations that have been made globally. So you are in distinguished company as a member of Sigma. And just so you know a little bit about the demographics of our population and our membership, over a third of our nurses have advanced degrees, masters and doctorates and beyond. 50% or more work actually in clinical settings, and about 20 to 25% are in an academic setting. At least 20% actually work in schools of nursing. So you can see that we span every professional domain of nursing and try to advance scholarship, leadership, and service in all of our activities. So when you look at the international scope of the organization, it can be quite humbling. You know, what can I do? What difference can I make when you look at the size and the scope of nursing? But in fact, every one of us is challenged to make a difference locally, regionally, and internationally. Every biennial, when we have our biennial conference, we have what we call the Parade of Flags. And we have representatives from every country in which we have a chapter participate in the parade, and they're selected to actually present their colors of the flags of the countries that we represent worldwide. And this is a picture of part of the group of parade of flags. So what binds us as nurses internationally? We all have different cultures and patient and client needs and different domains of practice. Well, one thing that allows Sigma to focus on one issue or a series of issues is the presidential call to action. Every 2 years, we install a new president, and our current president is Dr. Beth Tiggis out of New Mexico. Her call to action was called Connect, Collaborate, and Catalyze. When we connect, she saw Sigma's vision as the global organization of choice for nurses. But to be the global organization of choice, we have to collaborate. We have to identify elements of the Sigma mission that we can live every day in our professional careers and collaborate with nurses locally, regionally, and internationally to advance world health and to celebrate nursing scholarship and our excellence in leadership and service. But it has to be intentional collaboration. It can be serendipitous. Sometimes you may encounter somebody and find out that they're a member of Sigma. When you travel around the world, those of you that like to travel, I would always encourage you to reach out to the chapter where you'll be traveling and see if you can connect with some of the nurses in that country, because nurses really are without borders. Our collaboration needs to be intentional, both professionally and personally. And ultimately, through this collaboration, we will catalyze. And what does that mean? That means that things are going to happen, right? We're going to not only make recommendations, but see things happen, take action. And our global nursing excellence depends on new nurses and expert nurses in all roles to support each other, to mentor each other, to provide career coaching, and to identify on the circle those aspects of nursing that are most meaningful to us as we try to make a difference in this world. So again, through Dr. Tiggis's presidential call to action, we will connect, collaborate, and catalyze. And now as new members of our society, that is a charge that I would like to extend to all of you. So tonight, we are inducting all of you into this wonderful organization of Sigma. In fact, with you joining our chapter membership now, as of about 15 minutes ago, was 1,346 members. So congratulations on joining our chapter. WGU, primarily, as you know, is a national university, and we span all 50 states in terms of our students. And interestingly, our chapter that is affiliated with WGU also has representatives from all 50 states. We also have representatives from Puerto Rico and several of our military bases in the world. So when you think about our chapter and the influence that we have significant impact around the United States, and our chapter and our programs can touch the lives of many people. So today I would like to welcome our inductees, and I would like to scroll through a series of slides that will show your name and identify those of you, those great nurse leaders who are almost all alumni of WGU as new members of our chapter. And many of these people weren't able to join us today, but many of you are here. So thank you so much for your interest in joining Sigma and for accepting membership in Psi Upsilon. I also would like to recognize that we have several people joining us this evening who were members of Sigma and transferred their membership to our chapter or added our chapter as a multiple or dual member. Thank you so much for supporting our chapter and for remaining loyal to your membership in Sigma. So at this time, I would like to ask all of our inductees present to, if you can, please stand and recite the pledge after me. I accept membership in Sigma Theta Tau International,
in Sigma Theta Tau International,
and I pledge to fulfill its commitment
and I pledge to fulfill commitment
to nursing excellence, knowledge,
to nursing excellence, knowledge,
service, and leadership
service, and leadership
throughout my career.
throughout career.
Congratulations to all of you. You have joined the preeminent global organization of nurses. Congratulations. It is truly our honor to have you as members with us in our chapter. And I also would like to extend a thank you to those of you who are joining us this evening, family, friends, and colleagues of our inductees today. We know how challenging being a nurse can be. We work odd hours, we work, holidays and weekends. And we have many of our nurse leaders, almost all of them joining us this evening, were students at WGU as bachelor students or master students or both. And we know that they couldn't have done it without all of you. So please accept our heartfelt thanks and appreciation for everything you've done to assist our inductees in their professional success. Thank you. And now I'd like to introduce a special inductee. Jeff Solheim has been inducted today, and he is a 2011 graduate alum from WGU. Jeff is a highly accomplished professional, and he is going to provide us with our keynote address. Jeff has worked as a registered nurse for over 25 years in clinical areas as varied as the intensive care unit, medical surgical units, and the emergency department, as well as working as a flight nurse and cruise ship nurse. His roles in nursing span from the bedside through management and administration to trauma coordinator, nursing educator, nursing consultant, and state surveyor. I don't know when you sleep, Jeff. Jeff is currently the immediate president of the Emergency Nurses Association, as well as the Emeritus Executive Director of Project Helping Hands, a humanitarian medical organization that deploys medical teams to countries around the globe. Jeff is also a well-known speaker and author, having authored more than 20 books, and he also serves as editor or contributor to numerous other books. And in addition to that, in your spare time, Jeff, he has published in multiple journals and magazines. As an alum of WGU, we are honored to have him here to share his story as he weaves his tale of his travels around the world, how he has leveraged his graduate education to make our keynote presentation, I'm sure, an unforgettable one. With that, I'd like to introduce Jeff Solheim.
Thank you very much. And I assume everybody can hear me? I want to take this opportunity to thank the Psi Upsilon chapter of STTI for inviting me to have this honor of being able to address all of you. Even though we are all inductees, it's an honor to be chosen to just take a few minutes and share a few brief thoughts with you. I'm sure you all agree with me that it is quite an honor to be inducted into this chapter, and now to become part of the work that both STTI as well as Western Governors University does for the profession of nursing. You know, in Carol's introduction, you got a chance to hear just a little bit about my background, and I always say that to me, nursing is a gift. As I look back on my nearly 30 years in nursing, it's just been incredible. I've had the opportunity to be a staff nurse, a charge nurse, working through nursing administration, a trauma coordinator, state surveyor. I'm currently a flight nurse, international flight nurse and cruise ship nurse. I've been an educator, a consultant, a nurse entrepreneur, running, my own education company, consulting firm. And as we'll talk about in a minute, I've also had the opportunity to run my own not-for-profit, and we've deployed thousands of nurses literally all around the world, treating over 500,000 people in countries all over the world. And then last year, to be given the honor to represent my profession as the president of the Emergency Nurses Association. And, over the years, as a speaker and an author, I frequently get asked the question, what is the secret to, having such a varied nursing career? And for many years, I don't know that I had an answer. To me, it just was my life. But one day I decided to try to sit down and figure out what it is that allowed me to experience all these incredible things that I've had the opportunity to do in nursing. And I don't have a lot of time today, but I thought I would share just a few of the things that I uncovered as I kind of look back on my life and the experiences I've had. So the first thing I would share with you is part of my own personal success is my own belief in myself. And I often say this to my mentees that I work with, that true success often is recognizing who you are and believing in who you are. Many times, I think what stands between us and what we really want in life is us. We're sometimes afraid to take that step, or we don't have the belief in ourselves, or maybe we just don't embrace opportunities that come our way. But true success comes from believing in yourself. Believe in your dreams, and they may come true. believe in yourself, and it will come true. You know, I think about, as I share this story with you, I think about how I became a cruise ship nurse. It was kind of something I always wanted to do, and I looked into, you know, how to become a cruise ship nurse, and found out quickly that at least the cruise lines I was looking at required a 6-month contract the first time, and I knew that my life was far too busy for me to take 6 months to work on a cruise ship, so I kind of just shelved the idea as something I probably would never experience, or maybe it would happen late in my career. And then one day I was doing a motivational speech for an audience, and well, talking much about what I'm talking to you today, and I realized what a hypocrite that I was. Here I am telling, you know, tens of thousands of people every year to believe in yourself, and I have this dream that I wasn't willing to pursue. So after that, I decided I needed to look further into becoming a cruise ship nurse, and I started calling the cruise line that I had chosen I wanted to work for, and didn't get anywhere. They just kept telling me I needed to apply. I needed 6 months experience. So I decided to take it a step further, and I decided to fly to their headquarters in Seattle, Washington. And I arrived there without appointment and went to the office, and I asked to speak to the director of nursing. And they asked me if I had an appointment. And I said, well, I don't, but I flew all the way here to speak to you. Now, I didn't tell them that it was only a 17-minute flight from Portland, Oregon, what I call home, to Seattle. So they felt sorry for me, thinking I had flown all this way to speak to them, and they made room on the director of nursing's calendar. And I sat down with her, and I shared with her what I thought I could contribute to the cruise line and why I thought I'd be a good employee for the cruise line, but that I couldn't do the 6-month contract the first time out. And I am excited to say that shortly after that meeting I was hired on at the cruise line, and I began my career as a cruise ship nurse. And they allowed me to do a shortened 3-week orientation the first year. And now every year I just spend a few weeks working part-time as a cruise ship nurse. But again, I think that my ability to do that came from my own belief in myself, my willingness to pursue my dreams, and to not let what would look like obstacles stand in my way. So to kind of bring this to a close on this part, I would say never be afraid of being different. Be afraid of being the same as everybody else. Always believe in who you are and what you bring, and you might be surprised what opportunities await you when you seek them. The second thing that I would encourage you today to do is to surround yourself with the right people. Many times we tend to surround ourselves with those who we get along with well, those that bring us enjoyment, and those that often are much like we are, because that's what makes relationships so rich. And certainly it is important to have rich relationships. But as you think about who you're surrounding yourself with, I would ask you, are you surrounding yourself with the right people that will help to elevate you, people that help to fill in your own weaknesses and gaps to make you more complete? I often think of a story, excuse me, that occurred down in the Amazon jungle. And I was the team leader for one of the medical teams in my organization, and we were in the Amazon jungle, very, very deep in the jungle in a very, very remote area. It had taken us nearly 4 days to get into the area. And we had set up a temporary clinic in this very small community that had no access to healthcare. And during that day, a gentleman came in whose hand had been crushed in a rock while he was working, crushed under a rock while he was working. And he had a pretty significant crush injury to his hand. Now, the physician on this particular team that had come with us was an OBGYN, and he had told me at the beginning of the trip that if anything came in above the waist, he didn't feel he would be much help. So when I showed him the hand, he said, Jeff, I'm sorry, but that's above the waist. I'm not sure I'm going to be much help here. So I realized that this would be something that we as a group would need to take on. And I was actually able to suture up 2 of his fingers because, you know, they were just, the tissue was there, the tendons were intact, and I was able to suture them. But the one finger was significantly injured. It had missing tissue, the tendons were damaged, and it was certainly well beyond my area of expertise. Yet on the team, we had 2 other members. There was a nurse who worked in the OR and another nurse who actually worked for a plastic surgeon. And so I got them to come in and look at the hand, and they knew that the finger was no longer salvageable, and they decided to do an amputation. So right there in a hut with a dirt floor, they set up a sterile field, and they proceeded to take the tissue off the finger. And then to remove the bone, they used the tooth extractor from our dentists, and they cut the bone and they ronged it. And then the nurse who worked with the plastic surgeon was able to lift a small skin graft out of the gentleman's wrist and sew it over the stump that they had created. And by the end, we did a full amputation with skin graft in the middle of the jungle, without an OR, without lights, without anything that you might think of. And how did we do this? We did it because we worked together as a team. That we looked at each of our unique abilities, and together we were able to solve this problem. So as you look at who you are today, who are the people you surround yourself with? Do they lift you up? Do they fill in the holes and the weaknesses that you have? For if they do, you are more likely to be successful. But if you surround yourself with people who perhaps do not challenge you, who perhaps are very much like you and don't fill in your weaknesses, you may find that success is harder to achieve. Individually, we are just one drop, but together we make up an ocean. Who do you surround yourself with? Do they challenge you? Are they people who fill in your gaps? The third thing I would mention tonight that maybe is part of my success is understanding true professionalism. Nursing is a profession. We are considered a white-collar profession, and unfortunately many nurses don't always look at ourselves that way. They instead look at us as having a job. I'm guessing that many of you who are listening here today, who are being inducted alongside of me, understand that nursing is a profession, for you are seeking furthering your profession by being involved in this professional organization. But this is just part of being a professional. As most of you, if not all of you, recognize, higher education is part of being a professional. It's one of the reasons I sought after my master's degree in nursing through WGU. Even though I was already a chief nursing officer of a large hospital at the time that I went for my master's, and I probably didn't need it for job advancement, I recognized that as a professional, it was my responsibility to show leadership in furthering my education. And if I learned anything through my furthering education at WGU and getting my master's degree, I think the thing I learned most was to be able to see nursing from a much higher level and understand how we're part of a larger cog in the wheel of healthcare, but an important central cog. And I also began to understand the concept of professionalism in nursing. But it's more than just higher education. It is being involved in your professional organization. Of course, for me, I've been heavily involved in the Emergency Nurses Association for many years as an emergency nurse, including being the president of the association. But I'm also involved in the American Nurses Association, and now, of course, becoming involved in STTI. It's allowed, being involved in my professional organizations has allowed me to integrate with others that have allowed me many of the advances in my career that I enjoy. It allows me to stay current in my field, and it really helps me fulfill my professional responsibility as a white-collar nurse. And then, of course, I think we all need to recognize the importance of professional certifications. As you can see on the slide, I maintain the certifications that are important to me and the jobs that I have as an emergency nurse, as a trauma nurse, as a flight nurse. And to me, certification, board certification, is part of our professional responsibility as white-collar professionals. Nurses remain the lowest in percentage-wise when it comes to board certification amongst all white-collar professionals. So we need to set the example in furthering professionalism. The last thing that I would share with you today, because my time is almost up here, is the importance of a humble attitude. I do believe that part of my success is what I bring to the table from a personality standpoint. I was taught at a young age by my parents that we must care for all about us, and that we must always approach life as a humble attitude, in a humble way. And I have always tried to hold on to those values in everything that I do. From running a not-for-profit medical organization to my continued support, for example, of our homeless population. And I'll share with you a really quick story last year that almost got me in some trouble. But as the president of ENA, during my presidency, I continued to do a task that I have done for many years, and that is to go once a month and sleep on the street with the homeless. To me, it's an important part of staying in touch with the people that I care for in the emergency department, as well as staying in touch with just the people that are less fortunate than me, as a reminder of who I serve and who I am. So I had gone to the camp, and I dressed very much like a homeless person when I sleep on the streets, so I fit in. So I took my backpack and tent, and I went to a camp that I had never been at before, and I set up my tent, and I was just slowly beginning to integrate into the community. It takes always a little bit of time for the community to accept somebody new, but I shared, not my true story, but the story I make up as a homeless person. And so they had kind of begun to integrate me into their community that evening when suddenly there was police cars all around the camp. And they rounded us all up and set us on the curb. And here I was sitting on the curb with all these homeless people waiting to talk to the police officer and just hoping that no one driving by in the cars would recognize me, although the way I was dressed, that was unlikely. It finally came my turn to go into the police car. And so I went in and I immediately said, as soon as I was in the police car, I need you to know I'm not actually homeless. This is something I do, as part of my service to the less fortunate. And he kind of looked at me because I knew I looked homeless. And he asked me where I lived. And I gave him my address, which is in a very affluent area of Portland. And then he really looked at me sideways like I was completely crazy. Then he asked me what job I did. And I said, well, actually, I'm not working this year. I'm actually volunteering as the president of a large nursing organization. And then he looked at me like I was completely crazy. And I thought, this is it. I'm in a lot of trouble. Now, fortunately, he ultimately let me go to my tent and retrieve my phone, and I was able to call people who were able to vouch for me. But the next day, the joke at the office of the Emergency Nurses Association was this would be the first time the ENA president would ever have to be bailed out of jail, and I almost got that distinction at the Emergency Nurses Association. But, for me, doing things like serving others through my work and my third world organization or sleeping on the street with the homeless or whatever I do are ways that I can maintain my connection with those that are less fortunate than me. I am blessed. I have a wonderful career. I have a wonderful home. And I never want to forget those who are less fortunate than me. And I think by maintaining that humble attitude, it helps me to succeed. Humility is not thinking less of yourself. It's thinking of yourself less. As I bring this to a close tonight, I would remind each of you that we have been given a gift in nursing. Every day, we get the opportunity to change people's lives, whether it's something as simple as giving a toy to a child who's crying, or whether it's hugging a family who just lost a loved one. We get to change lives. We're in an unlimited field that allows us to do so many things. And you heard my varied background during my introduction, from cruise ship nursing to flight nursing to serving as president of ENA. And I can do that with my nursing career. We have the opportunity to affect and shape lives every day, no matter what area of nursing you're in. And I would remind you, as I say goodnight to each of you, never take this gift for granted. Always embrace nursing and all it has to offer. And love every minute of it. But just remember, in doing so, believe in yourself, surround yourself with the right people, always pursue professionalism, and always approach life with a humble attitude. Thank you for giving me a few minutes to share these remarks, and I'll give the microphone back to you, Carol.
Wow, thank you. That was an absolutely phenomenally inspirational presentation. Thank you so much, Jeff, for joining us. And now I've got to think about some spare time that I have to get a little more involved again. So thank you again for sharing your words of wisdom. It's just wonderful. And I don't really have much more to say in my concluding remarks. I can't say more than that, other than to share with all of you that this is your time to just stop and to think a little bit about what you can do to contribute to nursing in a different way. Just a slightly different way. I know how busy each and every one of you are. What can you do to make a difference, to bring Sigma to other colleagues, to share your leadership and your scholarship, and to identify areas of research? And it doesn't have to be a formal research project. Maybe it's just exploring an idea that you have based on evidence. So please know that we want to be there for you as a chapter. We want to serve you, and we hope that this membership benefits you. But we also know that we are the sum of our parts. And as Jeff mentioned about being the drop or the ocean, that the ocean of Sigma and the pond of our Psi Upsilon chapter is only as great as all of the drops that belong to us. And please make a splash with us. Please make a difference. And know that your involvement, your participation in our events your support of our activities allows us to provide support to the greater organization, and that is Sigma. So I just wanted to remind everybody, because of the tremendous response that we had in terms of our alum interest, we have scheduled another induction in March. And as new members, we would encourage you to join us. This induction in March is going to focus on existing students and probably some new grads, because as those of you that were students at WGU know, that you're graduating. Every day we graduate a new student. So we may have nominated them as a student, and they may have graduated before they're inducted. So we hope that you join us. We look forward to you being a part of our chapter, and know that you have our tremendous appreciation. Jeff, thank you so much again for joining us, for joining our chapter, and for reminding us what it is to be a nurse. Many thanks again to Elsie and Christy for coordinating this event and handling all of the induction items, and from my heart to Janine as well, because we can't do these wonderful virtual presentations without people behind the scenes ensuring that it happens. So again, thank you all so very much for joining us this evening. It truly has been our pleasure to induct you into our chapter. And now, actually, my slide changed, because we were 1,148 members. And thank you for joining our 1,346th group of people who will make a difference in the nation. Thank you again. And this concludes our ceremony this evening. Good night.